Good day. Today we will be presenting on the HIV and AIDS virus. Our names are Katrina Daniel, Selena Etienne, Anise Brown, and Johnny Lewis.
Hello, my name is Katrina Daniel, and today I'm going to be talking about how a person contracts AIDS. AIDS is a chronic, life-threatening condition caused by human immunodeficiency virus, HIV. There are three stages of HIV. We have the acute HIV infection, the chronic HIV infection, and the acquired immunodeficiency syndrome, which is AIDS. If HIV is left untreated, it can lead to AIDS. AIDS occurs when the number of CD4 cells are lower than 200 cells per cubic millimeters. The normal CD4 cell count ranges from 500 to 1600 cells per cubic millimeters of blood. There are several ways a person can contract HIV or AIDS. One ways are coming in contact with certain bodily fluid of an affected person. This commonly happens during sex when a person has sex with someone else that doesn't wear a condom. And we have sharing injection drugs equipment. If a person who has the infection injects the needle into them first, then give it to someone else who doesn't have the infection, then that person can be infected with the virus. During this time, the virus enters into the bloodstream and then it attaches itself to the T helper cells, which is the CD4 cells. And those cells helps to fight off infections and disease. When this happens, the virus then starts to make copies of itself in the DNA of the cell, and then it destroys the cell. After destroying the cell, it then goes into the blood, the peripheral blood, and then go and attack other cells. And then by that, when that process happens, then there'll be no more CD4 cells to help fight off this virus. And then we also have when the from mother to child. This here called mother to child transmission of HIV. This happens in several ways. It can happen during the pregnancy, during labor and delivery, or breastfeeding. During pregnancy, the virus is passed through the placenta and infect the fetus. During labor and delivery, a baby may be exposed to the virus in the mother's blood and other fluid. When a woman goes into labor, the amniotic sac breaks, and this, when that happens, it increases the risk of transmitting the virus to that child.
Good afternoon, everybody. My name is Selena Etienne, and I will be speaking on the structure and function of the renal and neurological system, and how it plays a huge part on the acquired immunodeficiency syndrome. So basically, these two systems work as, let's say, a garbage bin disposal company, let's say Bahamas Waste, and they take out excess waste from out the body. AIDS tends to destroy all parts of the body, so this limits the function of the system in regards to the body. Some organs become tired, for example, the kidney. If you see somebody on dialysis, their kidney just stops working, or probably they only have one kidney, so they need that functioning from something else in order to live or to carry out waste and other functions of that system. The T cells become too weak just as somebody who continues going to work every day, they get too tired to carry out their functions and they have to stop. So the T cells either slowly work or they just stop. So there's no functions working in the body becomes brittle, like I said, and everything just moves in slow motion. That's why sometimes people, they just die, or you could see them, they're living good, but their body internally is destroyed or not functioning. So that's it about the structure and function of the renal system in regards to AIDS. And there is no cure. So if you would go to the hospital and you get you want to go there for a cure or treatment, they would give you a palliative treatment because there is no treatment, so they would send you back home. Whereas there's nothing you can do about it except live your normal life until, I don't know, until time is up.
Hello everyone, I'm Anise Brown and I'm going to speak about AIDS and how the body changes when a person contracts this disease, or how the body is altered when a person has AIDS. The human immunodeficiency virus attacks a special type of immune system cell in the body, and that is known as the CD4 helper or a T cell. So when an HIV destroys the cell, it becomes harder for the body to fight off any type of infection. Because it is difficult for the body to fight off infections, it is difficult for the person to just fight off a minor cold or infection. HIV can be acute and HIV can be chronic. So when a person first contracts this infection, it may take a few days for the symptoms to show at first. But in the initial stage of HIV, symptoms may include fever, headache, rash, swollen lymph nodes, fatigue or excessive tiredness, and muscle pain. These are basically flu symptoms, and during this time, the T cells starts to fall very quickly. The immune system then tries to kick in, causing the levels to rise once again. But however, the T cells levels may not return to normal. In the acute stage, this is when the HIV has a greater chance of transmitting to others. This is because the levels of HIV are very high at this time. The chronic stage of the HIV is known as the latent stage or the asymptomatic stage, and during this stage, persons usually won't have any symptoms as in the acute phase because the virus doesn't multiply as quickly. How does AIDS affect the body? A normal T cell count ranges from approximately 500 to 1,600 cells per cubic centimeter of blood in healthy adults. A person receives an AIDS diagnosis when their T cell count is fewer than 200 cells. People with AIDS are more vulnerable to infections such as tuberculosis and pneumonia. They have weakened immune systems and are more susceptible to certain types of cancers, lymphoma, and cervical. A person living with AIDS has two conditions: lipoatrophy, which is fat loss, and lipohypertrophy, which is fat accumulation. Individuals who experience lipodystrophy may have a negative body image and may be depressed and socially isolated. Persons may lose or gain fat. Fat can increase in the abdomen, the neck, the shoulders, breast, or face area. But fat can also be lost in the face, legs, or arm. HIV affects the eyes. You get a blurry vision or double vision. The colors don't look right. Spots are in the eyes, and your eyes are watery or red. Your eyes are also sensitive to light, and your eyes hurt a lot. HIV affects the circulatory system, especially the kidneys. High blood pressure and diabetes are both related to HIV, and both can cause major kidney disease. A person with HIV has to get regular checkups from their doctor to ensure that there are no signs of kidney diseases. HIV also affects the digestive system. A person who has HIV has digestive problems. The virus or infection targets the walls of the person's intestines, resulting in digestive symptoms, and diarrhea is the most common one. Many persons with HIV has a form of inflammation called hepatitis. They must limit the amount of alcohol they drink, and having diabetes, high cholesterol or triglycerides, and being overweight can lead to fatty liver diseases. The mouth may be one of the first places where you notice signs of HIV. Things like dry mouth, fungal infections, gum disease, cold sores, and canker sores can make chewing and swallowing very painful. If a person goes too long, they might not be able to take the HIV medication or get the nutrients needed. HIV affects the skeletal systems. The person who has HIV tend to lose bone faster than people who don't. Your bones get brittle and can break more easily, especially in the hip area. So to keep your bones in shape, a person has to get plenty of calcium and vitamin D and exercise in ways that doesn't put weight on the bones, like walking or lifting weights. They must not smoke and limit the amount of alcohol they drink. And ask your doctor, how do you increase your vitamin D levels? HIV also affects the nervous system, the brain. Inflammation in the brain or the spinal cord can lead to confusion and other thinking problems such as weaknesses, headaches, seizures, and balance problems. When AIDS is so far along, you might get dementia and have problems remembering things. The nerves. When a person has HIV, it attacks the nerves, making it hard for the person to control their arms or control their legs or even control their bladder. HIV affects the skin. Many people get skin rash in their first stages of the HIV infection. It usually can go away without treatment within a few days or weeks.
Good day, my name is Johnny Lewis, and now we'll be discussing treatment when it comes to AIDS. All approved AIDS medication are classified by certain mechanisms of action. There are reverse transcriptase inhibitors, HIV protease inhibitors, HIV integrase inhibitors, inhibitors of viral entrance into the target cells, and there are inhibitors of viral attachment. The current treatment for HIV is a combination of drugs called antiretroviral therapy, also known as ART. ART protocols require a regimen. Timing of drug administration, dosage, and combination of drugs are important to this regimen. These are adapted based on age, secondary clinical symptoms like renal issues, T-cell levels, viral load, specific co-infections, pre-existing cardiac risk factors, and the list goes on. ART has proven itself to be an amazing combination of drugs and have been saving millions of lives. However, there are some resistance restraints, meaning that ART is not a cure. Using these drugs do not cure the disease because HIV incorporates itself into the genetic material of the host, which are the CD4 T memory cells, and may never be removed from the host, which may result in individuals being on these drugs for a lifetime. There are some downsides to ART. It has been found that taking these drugs after a long time can result in increased risk of cardio disease, metabolic disorders, and organ failure. Individuals on this treatment frequently fail to restore their immune system, and so this results in chronic immune action that is characterized by monocytes and T-cell production of inflammatory cytokines and depletion of Th17 cells. This chronic immune activation tends to exacerbate clinical diseases in adults and children. Why not create a vaccine? It would be the most effective way to prevent the virus, one may say. There isn't one because the ability of the vaccine to cure or prevent the virus is questionable. The HIV virus can be contracted genetically and antigenetically. So a vaccine may help with one area of contraction but not in another. Also, though the individual with HIV have a lot of circulating antibodies against the virus, they are not protective. So if the vaccine induces the circulation of antibodies, it can also do more harm than good.